This is Lee Cowan. The news from his physician that the president is doing, quote, very well.
And I think we're going to have a very good result.
Combined with the president himself saying that in his own words is all positive.
Again, over the next few days, we're going to probably know for sure.
But infectious disease specialists outside Mr. Trump's orbit echo what the president also said, that the next few days will be crucial.
So he still has a fight ahead of him.
Still has a fight ahead of him. We have seen patients who actually have prolonged symptoms until maybe 7 days, 8 days after the onset, and who actually develop complications at that time.
Dr. Albert Coe is chair of epidemiology of microbial diseases at Yale Medical School.
So what are we to make of the White House says he's probably going to be in the hospital for a couple of days? Does that give us any indication of how serious this might be?
This is really quite precocious and too early, at least in our experiences in taking care of patients with COVID. You have to take it kind of one day at a time.
Balancing the president's privacy with the needs of the nation to know isn't easy. CBS's chief medical correspondent, Dr. Jon LaPook, says that history tells us more information is more calming than less.
One of the basic concepts in public health is to be transparent. And I think that's especially important right now. We don't want to be parsing words. We don't want to be trying to interpret what somebody says. What did they really mean? You want to just have them look straight at you, tell you what's going on, and we can take it. We're grown-ups. We just want to know what's going on.
What we do know is the president is undergoing treatment, that 5-day course of the antiviral remdesivir, as well as a dose of monoclonal antibodies.
It makes scientific sense to me that you would want to give these kind of treatments that keep the viral load down as early as possible. But you have to also understand these are experimental treatments.
So what are the rest of us to take away from the president seeming fine one day and not the next? The cruel reality of COVID-19 is that even the best testing offers only a snapshot in time.
There are definitely gaps in what the tests can do and what they can't do.
Right. A huge misconception is, I just flew in from another city and I want to get tested today because if I'm negative, I can see my grandmother tomorrow. No, because if you were infected a week ago, you could test negative today and then test positive tomorrow and become suddenly infectious.
Which brings us back to what we've been hearing from health officials now for months. Face masks and social distancing remain our best defenses.
These are kind of the meat and potatoes of our public health response.
Whether the president's opinions on public health protocols will change?
They're great, and maybe they're just good, maybe they're not so good.
Is really anybody's guess. But for now, he shares an unfortunate commonality with more than 7 million Americans who have contracted the virus and is, for the moment, at its mercy.